goes like...
Speaking of cool, right here we have a dense patch of spider veins. So here we have a very interesting case. We have a classic blush of spider veins on the inner part of the knee. And what many people might do is just treat the spider veins directly. That would be a mistake. We actually showed on ultrasound today that there is a vein in her thigh which has backwards flow, which is pressurizing this patch of spider vein. So it's very important to treat that vein first. And the way we do it is with something called Ultrasound Guided Foam Sclerotherapy. So what we're going to do is we're going to advance this little butterfly needle into the feeding vein that is feeding these veins down here. If we look on the screen, at the very top of the screen, it can be hard to see, but there's a little circle right there. And that's a vein. You can see it open and close when I push on it with my transducer. That's our target. It's not very big. It's about, well, it's a little less than 2 millimeters in diameter. So you can see we got into the vein. You can see blood coming back in the hub. Now we're going to mix our foam. And the nice thing about this foam is it really shows up beautifully on ultrasound. It'll show up as white speckles inside the vein. Blood coming back into the hub. Now we'll inject the foam. You'll see the foam go into the tubing, and you'll watch the vein at the top of the screen fill with the white speckles. Beautiful. Excellent. So that's the branch coming off the great saphenous vein there that was feeding that little patch of spider veins in the lower thigh and medial knee. So now I'm going to take a look here. I made a mark on her skin where there was a tiny varicose vein right in the middle of those spider veins. So let's see if it's filled with foam. And it has. Look at all those speckles at the top of the screen. So you can see from that one injection site, we were able to fill the varicose vein around these spider veins as well as the feeding branch coming all the way down the thigh, all from one spot. Great. Okay, now that we've treated the feeding varicose vein, we're now going to do spider vein sclerotherapy on the inner part of her knee. And it's really, really nice that Marissa is pulling back on the skin. That helps to pull away the nerve branches so that she feels it less and pulls the skin very taut. It makes it a lot easier to do this procedure.